My name is Dr. Moshe Chasky, and I am board certified in internal medicine, hematology, and medical oncology, and I practice hematology and medical oncology on a daily basis here in Alliance Cancer Specialists. My wife and I relocated from New York City in 2005 to do a fellowship in medical oncology and hematology at Fox Chase Cancer Center. After my fellowship, I decided to go out to the community to practice hematology and medical oncology, and I decided to practice with Alliance Cancer Specialists, which has really been the best decision of my life. I wanted to talk today about a field of oncology that's actually become new over the last few decades, and that field is geriatric oncology. When you think of cancer, many people think that it's a disease of the young, but in fact, most cancers develop at an older age. For example, breast cancer, the average age is 61 years old, and that's one of the younger average ages for cancer. When you look at lung cancer or when you look at prostate cancer, the average ages are 70 years old. The average age of acute leukemia is 70 years old. So this population is a population that is extremely important to take care of and differently than the younger population. And how is that? So in the younger population, if you treated a patient that was 40 years old, you would have a regimen for chemotherapy to give that patient, and most patients that are 40 years old would be able to tolerate that chemotherapy based on the studies that have been done in that 40-year-old age group. But when you get to the elderly patient or any patient more than 65, you have to look at a deeper level of how to treat the patient than you looked at in the 40-year-old patient. Because most 40-year-old patients are able to live on their own, work on their own. They have normal other organs, such as a normal heart, normal kidneys, normal liver. As patients get older, they have other compromised organ systems or other compromised areas of their life where they may live alone, they may not have the same family support, and all of these things have to be taken into account when you treat the older patient. At Alliance Cancer Specialists, we have a multidisciplinary conference every week where all the surgeons and medical oncologists and radiation oncologists and radiologists and pathologists all get together to decide how should we best treat this patient. But what goes beyond that in the community is that when I take care of a patient in my practice, I have behind me all the doctors that have taken care of this patient prior to this patient entering my practice. And that includes the gastroenterologists that took care of their gastrointestinal issues, and the cardiologist that took care of their heart issues, and the lung doctor that took care of their emphysema. All of these doctors that know this patient well are part of my team in order to best take care of that patient and tailor the treatment best for them.